The chair now recognizes the gentleman from Michigan for 5 minutes.
Thank you, Madam Chair. My amendment ensures that our incredible healthcare and social service workers are aware that they are legally protected from retaliation by their employers. I'd like to begin by thanking my colleague, Congressman Joe Courtney, for his hard work on this outstanding bill, and Chairman Scott for leading on this issue and bringing the bill to the floor today. Healthcare and social service workers are some of this country's most precious workers, taking care of us and our loved ones, sometimes under some of the most trying conditions imaginable. H.R. 1309 will help protect these workers by requiring employers in the healthcare and social service sectors to develop workplace violence prevention plans. My amendment will require that mandatory violence prevention plan trainings include the critical information that these workers, when faced with any violent or unwanted behavior in the workplace, can safely report the incident without fear of retaliation. Bureau of Labor Statistics data tell us that private sector injury rates from workplace violence in healthcare and social service sectors increased 63% between 2006 and 2016, in just a decade. And due to underreporting, injury rates from workplace violence are widely assumed to be higher than the reported levels. This is a huge problem for workers, but also for those they care for, as violence in healthcare settings compromises quality of care. We cannot expect healthcare and social service workers to be able to deliver essential, life-saving services under the threat of violence and assault, and fear of repercussions for reporting any incident that may occur. The same goes for social service workers. A safe and violence-free workplace is essential to a functioning social service system that will help our communities thrive. And we cannot expect workers to come forward with reports of violence if they fear retribution. My straightforward amendment aims to ensure that healthcare and social service workers covered by this bill are aware of their right to come forward and report any incident of violence at work without fear or retribution. And Madam Chairwoman, let me just add that this is really personal for me. I don't want to reveal my age, but I started organizing healthcare workers for SEIU in 1983. And I remember my very first campaign at Shore Haven Nursing Home in Grand Haven, Michigan. And some of the workers in the nursing home did face violence on the job, and they really had no way to handle it. So Mr. Courtney's bill, his leadership on this, is so essential for all of the health and social service workers of our country. I urge my colleagues to support this amendment, and I reserve the balance of my time.